Hello, everyone, and welcome to our project proposal presentation on the influence of public health interventions and socioeconomic factors on the spread and severity of infectious diseases. This project is brought to you by Group 13. We have Greg Finkelberg, we have Jisoo Chae, and we have me, Jennifer Moreno.
Our research is driven by the question, how do public health interventions and socioeconomic factors influence the spread and severity of infectious diseases, specifically COVID-19, influenza, and SARS? Understanding this relationship is critical for improving disease control strategies, public health measures such as vaccination, social distancing, and improved sanitation have played major roles in managing outbreaks, but their effectiveness varies based on socioeconomic conditions. By analyzing epidemiological and socioeconomic data, we aim to identify which interventions work best on how disparities in healthcare access and living conditions shape disease outcomes.
Importance of the research. Public health intervention. Infectious disease such as COVID-19, influenza viruses, and SARS pose significant public health challenges worldwide. Various public health interventions, including vaccination programs, social distancing measures, improved sanitation, and lockdown policies, have been implemented to control the spread and reduce the severity of these diseases. Understanding their effectiveness is crucial for guiding evidence-based policymaking and improving disease control strategies.
On this slide, we'll talk about our data sources. For our domestic data source, we have our CDC OneVer database. Here we will extract data on disease incidence, mortality rates, and intervention policies by the U.S. In order to investigate a possible relationship between intervention strategies such as vaccination rates and social distancing policies and disease severity. Another database we'll be utilizing is the World Health Organization's Global Health Observatory, which contains a collection of international data on disease prevalence, vaccination coverage, and public health policies. This will help us to compare disease trends across countries with different intervention strategies. Then to gather our socioeconomic data, we will pull data from the Center for Systems Science and Engineering, or CSSE, at Johns Hopkins University. So the socioeconomic data characteristics from this database that we'll use include GDP per capita, health per capita, life expectancy, sanitation, air pollution levels, and more. So on this slide, we'll cover our literature review studies that are related to U.S. and global socioeconomic impacts. In Amandi et al.'s 2021 analysis of the global burden that infectious diseases have on countries with varying levels of socioeconomic factors, their results indicated that lower socioeconomic countries experienced a higher level of burden. Then in Yin et al.'s 2023 paper, they used spatiotemporal modeling to analyze COVID-19 transmission. Here, the authors identify strong correlations between disease spread and factors like population density, socioeconomic deprivation, and environmental conditions, which I thought was really interesting to include the environmental conditions in the study. In the paper here, we have entitled Socioeconomic and Demographic Factors Influencing the Spatial Spread of COVID-19 in the USA. Researchers' findings suggest that socioeconomic factors and other demographics played a role in the spatial spread of the virus.
Domestic studies on public health interventions, vaccination and COVID-19 outcomes. In 2024, Gartner analyzed the relationship between vaccination rates and COVID-19 health outcomes across 48 United States. The study found a strong negative association between vaccine uptake and COVID-19 severity, emphasizing the crucial role of high vaccination coverage in reducing hospitalization and mortality rates. Hand hygiene in healthcare settings. Pitet et al. In 2000 demonstrated that a hospital-wide hand hygiene program significantly reduced healthcare-associated infections in the United States. The study underscores the importance of improved sanitation practices in mitigating the spread of infectious disease, including SARS and influenza viruses. Social distancing and mobility restriction. In 2021, Chae et al. Evaluated the effectiveness of social distancing policies, lockdowns, and travel restrictions in controlling COVID-19 spread in the United States. The finding confirmed that these measures substantially reduce transmission rates, though they also have socioeconomic trade-offs. International studies on public health interventions. Global impact of vaccination programs. In 2023, Malkadas et al. Estimated the impact of COVID-19 vaccination in the United States and compared it to global trends. The study utilized epidemiological modeling to quantify the number of worldwide cases, hospitalization, and death averted by vaccination program. Effectiveness of public health measures in LMICs. In 2021, Basnier et al. Conducted an umbrella review examining public health interventions in low and middle income countries. The studies highlighted the effectiveness of vaccination campaigns, improved sanitation, and nutritional support in reducing morbidity and mortality rates from infectious disease, including influenza viruses. Tracking epidemic trends with models. In 2023, Fang and Wang introduced a switching state space transmission model to assess the impact of interventions in various countries. This model effectively tracked changes in disease transmission over time and provided insights into the effectiveness of different public health policies. These studies collectively provide a domestic versus international perspective on how public health interventions shape infectious disease outcomes. By integrating findings from the CDC and WHO databases, this research will comprehensively assess policy effectiveness across diverse settings.
On this slide, we'll discuss our research methodology. So first we started our research by doing a systematic literature review that compares the intervention strategies across different geographic and socioeconomical contexts. We aim to compare intervention strategies for infectious diseases and different socioeconomic impacts. And we wanted to do that across different demographics. Our comparative case study analysis focused on the US as well as international case studies. Going forward, next, we will gather and clean publicly available data as we prepare for our quantitative data analysis. We'll perform our exploratory data analyses tests. Then for our statistical modeling, we will perform regression analysis and mapping.
To answer our question, we will use a data-driven approach, incorporating multiple sources of epidemiological and socioeconomic data. The first database we're going to be utilizing is the CDC Wonder database. We will extract US data on disease incidence, mortality rates, and public health interventions. This will allow us to compare the effectiveness of different policies at the state level. The second database will be the WHO Global Health Observatory. We will analyze global trends in disease prevalence and intervention effectiveness, providing broader context for how different countries manage infectious disease outbreaks. The statistical tools we will utilize we will apply regression models to assess the correlation between public health policies and disease severity. Trend analysis will help us track changes in infection rates over time in response to interventions. Data visualization techniques will be used to present our findings clearly, utilizing tools such as R, Python, and Power BI. By integrating these methods, we can develop a comprehensive understanding of how public health strategies and socioeconomic factors influence disease outcomes.
Expected outcomes. We should be able to identify the most effective public health interventions for controlling the spread and severity of infectious disease. We should also be able to provide evidence-based recommendations to help policymakers optimize public health strategies at both national and international levels. To identify best practice, we will compare the effectiveness of different intervention approaches across various socioeconomic and demographic settings. We will also offer insight into how public health measures can be balanced with economic and social stability for long-term sustainability.
In conclusion, this study will provide a data-driven assessment of the impact of public health interventions and socioeconomic conditions on infectious disease spread and severity. Our findings aim to guide future public health strategies by identifying the most effective intervention methods. Additionally, this research will help improve preparedness for future disease outbreaks by offering insights into how socioeconomic disparities impact public health responses. Ultimately, by combining epidemiological data with advanced statistical analysis, we hope to contribute valuable knowledge for policymakers and public health professionals working to mitigate the impact of infectious diseases worldwide. Thank you for your time and for watching our presentation. Let us know if you have any questions.